So we've been preparing for about 14 months now with the other healthcare systems in town, the Cleveland Clinic, St. Vincent Charity, Metro Health, and us here at University Hospitals. We've been preparing for little emergencies, just an increase in volume because of all the visitors, and for big emergencies, God forbid a mass casualty event. We've done tabletop drills, we've done live patient drills, we have talked to federal partners, we've talked to state partners. The amount, the level, the intensity of collaboration has never been better, and I'm very happy with how prepared we are.
We're prepared for the spectrum, and that spectrum is what happens when you just put a bunch more people in Cleveland. Like with the Cavs celebration, it was over 1 million. Obviously, the RNC won't be near that many, but we're looking at 75,000 plus people coming into Cleveland. We're going to expect more flu, coughs, cold, respiratory type of symptoms. The bars are also open an extra 3 hours, till 4 a.m. in the morning. So we're expecting more alcohol challenges, dehydration, things that we'll have to manage in the EDs from that, all the way to conflicts between the free speech advocates or the protesters and law enforcement, and then on to mass casualty situations.
A mass casualty incident would activate our command center, activate a disaster for the hospital. We are a big system, 15 hospitals, so we can bring resources in from all these different facilities. Our emergency department, led by Dr. Chris Miller, has been drilling and preparing. Our trauma surgeons, we're a level 1 adult and pediatric trauma center. They've been drilling as well, and they know there's no vacation during the week of the RNC, and they need to be at their ready. So once again, you can put all these great plans in place, and I think the collaboration that we've had with the city, with EMS, with the commanders, especially with the Secret Service who've been leading this, has really been terrific. I'm very confident.
Mass casualty situations are the ones which obviously worry us most. So we've thought about Boston and the bombing during the marathon, but we've admired how the hospitals, even though it was a terrible event, the hospitals mitigated that at least a little bit by their ability to respond. They did a great job. Same thing in Orlando. There was a hospital which was close. They handled many patients. They were a level 1 trauma center, and they did tens of surgeries within a very short time.
You never know how prepared you are until, God forbid, something happens. And I think if you look at the hospital in Orlando, one of the most amazing stories is they had just drilled a mass casualty drill, and they're obviously to be commended for the amazing response they had. So once again, you can never drill enough, you can never practice enough, and I think we've done a very nice job of that.
The Secret Service told us to be independent for 96 hours, and that may sound surprising because it's not really a Katrina event, but they said in mass casualty situations, you should have supplies for 96 hours. So we've stocked up. In thinking about that, what we've done is we've staffed up general surgery. So we have names of people who are on call for the first 12 hours, second 12 hours, all the way through 96 hours, where we would operate continuously. And if the level 1 trauma centers got overburdened in town, we could do 200 cases in the first 96 hours, and that's just of general trauma cases. We've also staffed the same way for neurosurgical, orthopedics, and head and neck trauma.
But when it comes to how would we handle a mass influx of patients, how would we communicate with the city and the county, how would we get ambulances, how would we get personnel, we've really been collaborating on those plans. And the Cleveland Clinic had me over for a planning meeting. I've invited folks to our place, so it's been great collaboration. You know, we're really hoping this doesn't impact normal patient care, because we have not canceled surgeries, we have not told people not to come to hospital. We want to provide the great care that we provide to 1 million patients in Cleveland or in Northeast Ohio every year. Is it going to be hassle for traffic? Is there going to be some potential issues with protesters? Yeah, there's going to be some contingencies, but it's going to be business as usual. We want our patients and families to get great care, and we really haven't modified a whole lot.